Welcome to Spotlight on Chronic Kidney Disease here on Hospital Radio for Bristol, where this time we look at educational support. Academic and chartered scientist Shahid Mohammed firstly explains what prompted them to form the Renal Patient Support Group, or RPSG.
There were patients and carers who looked very anxious because of the time constraints in appointments. Myself and my colleagues decided to actually develop the RPSG, which primarily started as an open Facebook group. We knew that patients, carers wanted space to share lived experiences, and that's how it all started.
What are some of the pros and cons of doing research?
The advantages of being a healthcare scientist is that you get to understand the real issues that are going on in healthcare from a main science perspective, a laboratory perspective, and understand the concerns coming from clinicians from the front line and how they face particular conundrums and how patients must be feeling. The disadvantage is that because healthcare scientists aren't really patient facing, although we're very empathetic, unfortunately, when it comes to delivering aspects of healthcare, the disadvantage is that we never really are able to put ourselves in the patient's shoes, whereas frontline health professionals have that advantage.
So, what was one of the first research projects and how did it benefit patient care?
One of the first projects that were done with the Renal Patient Support Group, the RPSG, was one relating to how young people cope with chronic kidney disease. This was an academic research project that was a collaboration really between the RPSG, the University of West of Scotland, and the Birmingham Children's Hospital. How it benefited was it highlighted how social media can be used as an advantage, a tool really for different age groups and from different genders and backgrounds. And that work got presented at the Excellence in Pediatrics Conference in 2010, and it got presented in a kidney care conference in Helsinki in Finland as well.
Why is educational research required?
The RPSG has focused on different practices, but also highlighting where, for example, if there are health professionals who want to collaborate, for example, recently I had a communication with a transplant surgeon about having collected some pilot data, collaborating on the idea that we would focus on more educational perspectives where different healthcare professionals can be involved, and especially if they're not really patient facing.
What is the real issues surrounding kidney care and research?
The real issues are that some of the most sensitive topics are still not getting out there in the public domain. So, for example, kidney care and how patients might be going through that health issue. Another sensitive topic relating to that might be because of the routine appointments that they usually have to go through, they may find it difficult to find job opportunities because their healthcare becomes a priority, you see. And so the livelihood of patients can be affected as well. But there's also areas and focuses around the laboratory perspectives. So, for example, which biomarker has more credence versus another when it comes to detecting renal insufficiency.
What else would you like to share?
What I like to share is that chronic kidney disease is a very important healthcare concern or issue in relating to public health, though it's not really focused on as much as it should be. So I want to highlight that at least. And from a laboratory and a healthcare science perspective, I want to highlight that if people have time to check out the Renal Patient Support Group, the RPSG, there's different YouTube channels, and a lot of that is not complex. The effort has really been to break down that language barrier so that people can get the best out of their healthcare.
Spotlight on kidney care here on Hospital Radio for Bristol with academic and chartered scientist Shahid Mohammed.